Hi, my name's Tim Frayling. I'm a professor of human genetics at the medical school at the University of Exeter. So the Gemini project is a research project designed to understand why some people develop multiple long-term conditions, whilst others of a similar age might only develop one or two conditions. So long-term conditions are what we call chronic diseases and conditions that you live with for a long time. One example would be patients who are suffering from both type 2 diabetes and osteoarthritis. But as we go through the project over the next 2 to 3 years, as we discover more from the patient's data and the work we're doing, we will focus on other combinations. It's different to previous projects in that we're going to use genetics to try and understand the causes of why some people have more than one condition and other people don't. It brings together a group of scientists from a wide range of disciplines. It's called team science and is very much about bringing together experts from slightly different backgrounds, slightly different ways of looking at a disease, slightly different ways of looking at data. And that makes for better studies, it makes for better science because we're all challenging each other. Really importantly, it's not just scientists, we have several patients involved. It's really important that scientists don't just study people's data, that they get to talk to patients and find out about their real experiences out in the real world. So we're particularly interested in hearing from patients directly who have particular combinations of multiple long-term conditions. You will also be interested in hearing from carers. So sadly, many of the conditions that we're looking at will involve mental health issues, particularly dementia in older patients. And obviously for those patients, it can sometimes be harder to actively take part in research projects. And so we can often learn a lot from their primary carers. One of the main benefits to patients will be improved clinical trials, so better informed clinical trials. We'll have a better idea of which drugs will work in which patients, which non-drug type interventions will work in which patients. And we hope that will mean a faster, more efficient pipeline to better treatment for patients with more than one long-term condition. And because we are focusing on patients who have more than one condition at the same time, not just starting with one disease and looking at other diseases related to it, those interventions will be very relevant to patients with multiple conditions.